When you see someone twist their arm into an impossible angle, it usually looks like a harmless party trick. But beneath the skin, that extreme flexibility is actually a mechanical breakdown. In patients with Ehlers-Danlos syndrome, or EDS, the body's hardware is failing. The human skeleton relies on ligaments to hold bones in their proper alignment. You can think of healthy ligaments as tight, rigid ropes. But EDS is a connective tissue disorder. A genetic mutation causes these ligaments to form improperly, leaving them loose, stretchy, and weak, like worn-out rubber bands. Because those bands have too much give, the bones literally cannot stay in place. A simple misstep or a sudden reach can cause the joint to slip out of the socket. These partial dislocations are called subluxations, and for someone with EDS, they are a source of constant, severe chronic pain. This lack of structural integrity makes ordinary tasks incredibly difficult. Even trying to hold a pencil forces the unstable finger joints to collapse inward under pressure. Without tight ligaments to lock the skeleton in place, the body's primary stabilization hardware is defective. Every single joint is left completely unprotected against the everyday forces of gravity and motion. The obvious answer to this weakness would seem to be physical therapy, but here is the paradox of living with EDS. Attempting a typical physical therapy routine frequently leaves these patients in significantly more pain. Standard fitness logic dictates that tight muscles should be stretched, but for a hypermobile patient, their joints already move too far. Applying a traditional stretch physically forces those unstable joints well past their safe structural limits, causing further damage to the connective tissue. To understand why standard exercise fails, we have to look at a mechanism called proprioception. This is your brain's ability to subconsciously sense exactly where your limbs are in space. Because EDS patients have unusually loose tissue, the nerve endings inside their joints don't send reliable signals, impairing this internal tracking system. When you combine that poor proprioception with high-impact activities like running or jumping, injury is almost guaranteed. The patient cannot feel that their knee or ankle is buckling inward until the damage is already done. If normal movement hurts and standard physical therapy actively causes injury, surviving this condition requires throwing out the traditional fitness rulebook entirely. We cannot change the body's genetic code. The flawed ligaments are going to remain flawed. So specialized physical therapists bypass the hardware entirely. Instead, they use advanced sports science to train the muscles, the body's software, to take over the job of stabilizing the skeleton. This clinical intervention centers on eccentric training, a method for building strength without putting destructive force on the joint architecture. While concentric movements focus on shortening a muscle as it contracts, and isometric movements hold a static position, eccentric training is different. It focuses entirely on lengthening the muscle while it is under tension, like slowly lowering a heavy weight during a bicep curl. By focusing on that slow descending phase, eccentric training builds extreme muscle control and density. More importantly, it does this without placing sudden, snapping stress on the already fragile ligaments. It operates as a complete biomechanical override. By heavily engineering the surrounding muscles, therapists systematically transfer the burden of holding the skeleton together away from the defective ligaments and onto the muscle tissue. Moving from the cellular level to a complex joint shows exactly how much precision this requires. Let's look at the knee. This clinical slide outlines the mechanics of patellofemoral pain in EDS. Because the ligaments are loose, patients often stand with their knees hyperextended backward. That extra slack allows the kneecap to simply float out of its intended groove. And the problem isn't isolated. Looking at this alignment diagram, the red dashed line shows the biomechanical axis. Flat feet at the bottom cause the entire lower leg to turn inward, while simultaneously, tight muscles up in the thigh yank the kneecap outward. Fixing this requires a multi-step intervention. Therapists must carefully release the tight thigh muscles, apply physical bracing or taping to manually hold the kneecap, and then aggressively strengthen the hip and foot muscles to pull the entire leg back into alignment. Stabilizing a hypermobile body is not a matter of resting the sore spot. It means treating the human body as an interconnected mechanical network, where every single pulley, lever, and weight must be perfectly recalibrated to keep the bones from slipping. This creates a massive logistical challenge in a clinical setting. How do you apply intense mechanical adjustments to a patient whose entire body is inherently unstable? If you fix the knee but ignore the hip, the pelvis might dislocate. As this presentation slide points out, this is exactly why specialized clinics rely on strictly standardized protocols. Without a consistent, mapped-out approach, physical therapists will inevitably miss hidden dysfunctions and accidentally trigger further injury. One major framework is the Mole-Downey protocol. It physically divides the body into distinct sections, separating the upper spine from the lower spine and pelvis. Therapists must stabilize the core, the sacrum, and the lower back first, ensuring the body has a solid center of gravity before they even attempt to fix the arms or legs. Throughout every step of these protocols, therapists follow the absolute governing rule of hypermobile exercise physiology. Start low and go extremely slow. Repetitions and weights are introduced at microscopic increments to ensure the fragile system is never overloaded. By adhering to strict systemic guidelines, clinical teams can safely dismantle bad movement habits and physically rebuild a completely unstable patient from the ground up, avoiding the severe pain cascades that usually accompany exercise. The timeline for this process is long, but the physical transformation is massive. Over months of specialized therapy, patients transition from a state of constant fragility, where simply turning around could cause a dislocation, to a state of reliable bodily control. The rigorous eccentric training eventually becomes permanent muscle memory. Their upgraded proprioception works automatically in the background, keeping joints tightly engaged and preventing injuries while they do everyday tasks, like walking upstairs or reaching for a high shelf. Ultimately, the goal of these specialized physical therapists is to make themselves obsolete. They focus heavily on education, teaching patients exactly how to identify their own misalignments, stretch safely, and manage their joint health completely independently. Applying the same biomechanical rigor used for elite athletes turns sports science into a life-saving medical intervention for chronic illness. For the EDS community, these principles provide the engineering required to build a stable foundation, finally allowing the body to function as it should. The timeline for this process is long, but the physical transformation is massive. Over months of specialized therapy, patients transition from a state of constant fragility, where simply turning around could cause a dislocation, to a state of reliable bodily control. The rigorous eccentric training eventually becomes permanent muscle memory. Their upgraded proprioception works automatically in the background, keeping joints tightly engaged and preventing injuries while they do everyday tasks like walking upstairs or reaching for a high shelf. Ultimately, the goal of these specialized physical therapists is to make themselves obsolete. They focus heavily on education, teaching patients exactly how to identify their own misalignments, stretch safely, and manage their joint health completely independently. Applying the same biomechanical rigor used for elite athletes turns sports science into a life-saving medical intervention for chronic illness. For the EDS community, these principles provide the engineering required to build a stable foundation, finally allowing the body to function as it should.